Let's go to Carol, who's calling from Erie, Michigan. Carol, what's your question tonight for Dr. Gray?
Hi. I have a question about double chin and jowl. I am, in a couple weeks, going to turn 50. I am not technically overweight. However, I would like to lose a few, but according to my weight and my height, I'm normal. But I think, excuse me, the genetics of my double chin is the problem.
Yes.
And I would love to have it removed or however, liposuction or surgery or whatever, but I'm concerned. Someone once told me that it makes it real difficult to swallow right after the surgery, with the couple weeks after surgery.
The most important thing for people out there listening, don't talk to people. They don't know what they're talking about, okay?
Yeah,
if you want to ask a question, you can't ask a doctor. You have to ask me, because I'm the guy that does it, okay? So if you ask your family doctor, you're not going to get the answer. He'll talk to you about just general medicine. He's not a surgeon. Right. If you ask any old surgeon, he can't answer you because he doesn't do what I do. So here's the thing. When you just remove the fat, the volume will go down. When I evaluate you based upon my life experience in doing this, I have to look at your skin and determine what your skin will do at that point. And I have to advise you. And your skin will basically glue back without the oil, the fat underneath, lubricating it to the muscle. And then the question is, what does the muscle look like? If the muscle doesn't look so good, I can change the shape of it. And I do that with very secretive techniques. All right, that's why cosmetic surgery people don't know what we're doing, nor do the other doctors. And basically, we can take the muscle up and back and realign your muscles of your neck and give you a sharper neckline. Now, if you put your fingers around your neck and push and you swallow, you can swallow, but it's tighter. That feeling will go away usually within the week, and rarely, if ever, do I hear anybody complain about that, okay? Like never. And they love their new look, okay? If we want to remove the skin, reduce the fat, and change the muscle, we can do just your neck. That's called a neck lift, okay? And depending on how aggressive the physician wants to be, determines the type of result you get. But not every chef is a chef. Not every artist is an artist. Who you go to is very important. You can't just go to anybody. You don't walk to any hair salon and have anybody do your hair. That's what no one understands. You just don't do that. But the problem is, with what I do, you don't know who to go to. So you have to go based on reputation, okay?
800-859-0WJR, 800-859-0957. If you have a question for Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa. John's calling from Royal Oak. John, good evening.
Hi. My wife gave birth 5 years ago, and she's got stretch marks on her stomach and breast. Can you do anything about that?
Yes, we have lasers that will tighten the stretch marks. We can get at least a 50% improvement, maybe more out of those. It depends on how bad and how the stretch mark is and how aggressive of the therapy you choose to do. So, yes, there are treatments for that.
John, thank you for your question tonight. 800-859-0WJR, 859-0957. Diane's calling from Wyandotte. Good evening, Diane. What's your question for Dr. Michael Gray?
Hello.
Hi, how are you?
Fine. Now, I'm a person who is older than the average age that you probably do your methods with. I'm curious, for a person in their 70s, what would be the best way to go for a facelift, a total one, or some of the laser treatments that I have heard about?
Okay. What's best for you may not be best for someone else. So basically, your age group are the people that are doing these things, okay? And that's the average age for people who do facelifts, because people 40 typically don't do this. So basically, there's no such thing as a full face or a whole facelift. That does not exist. That's layman's terminology. Basically, a facelift means we're going to correct the jowls and your neck, and that's a facelift. There is no full facelift. If you're implying, are we going to raise the brows, we can do that if you want to do a brow lift, but that's a brow lift. That has nothing to do with the facelift. So some people join them together and they go full face. Well, that doesn't mean anything. So if you're looking for surgery, I can create your result for you, and that's a facelift, which jowls and neck. You want the neck? We do the neck. You want just the jowls? We can just do the jowls. You can do a liquid facelift where basically we're just filling in the areas that are folded and making it look less deep and improving it. We can use lasers on your skin to help tighten it. We can do liposuction to reduce the volume in certain areas, and we can do fat transfer and fillers to increase the volume in other areas. So when I look at your face, these are the things that we go over in consultation to figure out what you want to do. I never decide for you. I always let you decide what's best for yourself.
800-859-0WJR, 800-859-0957. Dr. Gray, I want to ask you about the Skin Deep Spa, the things that you do there, the procedures there, spa facial, spa body, I mean, just the gambit.
Well, it's not really a spa like you would think of a spa. Basically, what Skin Deep is non-surgical intervention. There is technology out there that I've been talking about today where we do a lot of these things at my Skin Deep, because there are basically two groups of people. People who are very aggressive, they want to do surgery and procedures, and people are not yet ready for those things. There are people that want to maintain what they have. They don't want to lose what they have. They're prophylactically treating their body, maintaining it like you maintain your car. You wash it, you wax it, change the oil.
Right.
Those type of people will be going to Skin Deep. And they will be doing lasers that help heat and tighten the skin, taking care of the pores, taking care of the blood vessels that are appearing. If they have tattoos, we have lasers that remove tattoos.
I was going to ask you about that, because you're starting to see more and more of these. You know, you get a tattoo when you're 20 or 18, and now you're 50, and that same tattoo doesn't,
Well, here's the thing.
Change.
People get tattoos that mean nothing to them. If I had a tattoo of my daughter on my arm, no one would ever touch my arm. It's my daughter there.
Okay.
People get tattoos that are meaningless. So they change their style, and they don't like the meaningless tattoo, and they want to get rid of it. A lot of mistakes going on out there. So we're very busy with tattoo removal, and we do cellulite treatments. Yes, there is a treatment for cellulite, but it's not a cream. Okay?
Okay.
So, I mean, stretch mark there. We do these things at Skin Deep. That's what we do. It's not, if people want to get a massage, they can get a massage. They want to get a facial, they get a facial. They just want to maintain the skin and make it look nice. We have lasers for that, too.
800-859-0WJR, 800-859-0957. If you want to talk to Dr. Michael Gray from the Michigan Cosmetic Surgery Center and Skin Deep Spa. From Novi, here's Tom on the WJR Live Line. Tom, what's your question tonight?
I was told I'm too clinically obese for liposuction. I was told I got to get a lap band surgery, and I'm curious why that is or what the difference is.
How much you weigh?
400 pounds.
Tom, this is the way it works. You can have lipo. You have to go to a physician that does people like you, okay, which I do. The physician has to feel comfortable taking care of you, all right, and you have to be healthy enough to have the procedures that you do. No one can force you to do something that's dangerous, like lap band or Roux-en-Y gastric exclusions and things like that, gastric bypasses, where we're actually rerouting your intestines, and there's a chance for leaking and death and DVTs and things like that, clots going to your heart, etc. Lipo is a pretty benign procedure, but certainly we wouldn't take you into the operating room and do your entire body. This is something that you would make a commitment, and you pick the spots that bother you, and we slowly correct those spots. It's not something we're going to do at one fell swoop. But you don't have to do anything dangerous if you don't want to.
Thank you for that, Tom. Hope that helps you. 800-859-0WJR, 800-859-0957. Before the break, let's take one more. Molly from Canton has been waiting patiently. Molly, what's your question tonight?
Hi. I have a son who is 18 years old, and he has moderate to severe acne. And he's been to several dermatologists, tried all kinds of soaps and potions and several antibiotics, and nothing short of the Accutane, which I don't want him to take, has helped. Do you have anything that you could do for him?
Yes. We do have Omnilux, which will prevent and slow down the active acne from occurring. Acne basically is due to bacteria that's deep in the skin eating you, and it's causing holes, eating the skin, and then as your body's trying to heal, it deposits glue, which is scar tissue, and you get a mark there. And if it goes through the skin and into the fatty layer below the skin, you get a pot mark, an indentation. So the key is good cleansing of the skin, opening up the pores, oxygenating the deep layers of the skin using Omnilux, which these bacteria can't live in the presence of oxygen. And then once the damage has occurred, we have to repair it. So it's a combination of possibly fillers into the skin to restore the volume, using lasers to smooth and resurface the skin. But the key is prevention.
What about a person, Dr. Gray, who has had chickenpox as a youngster and they have the marks from the scratching maybe in their face? Is there anything you can do about that?
Yeah, that's basically, we treat it the same. We filled that area in with, there's long-lasting fillers that last 5+ years, okay? Depending on how severe it is, we can do a laser treatment over it, which basically resurfaces and smooths, okay? So it could be combinations of filling and lasering.
800-859-0WJR. You're listening to the special edition of The Big Story Tonight with Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa. We'll take a break and come right back with more of your calls at 800-859-0WJR.
Welcome back to this special edition of The Big Story. Tonight, Lloyd's special guest, Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa. Call WJR now with your cosmetic surgery questions for Dr. Gray at 800-859-0WJR. That's 800-859-0957. Once again, here's Lloyd Jackson.
800-859-0WJR, 800-859-0957. If you have a question for Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa on this special edition of The Big Story. Aaron's waiting patiently from Carlton. Aaron, what's your question tonight for Dr. Gray?
Hi, doctor. My question is, I have a low forehead. I have thick hair, but I was wondering, is it possible to reshape your hairline or to raise your hairline permanently?
Yes, of course. I mean, if you're asking about laser hair removal, I mean, we can do that as long as the hair is dark and not blonde or gray. We have a new laser, new technology on the Zeo platform. This laser can use on any color skin.
Aaron, thank you for your call. 800-859-0WJR, 800-859-0957. Wendy from West Bloomfield, what's your question tonight for Dr. Michael Gray?
Hi there.
Hey, how are you, Wendy?
Good. I just heard about this really interesting new procedure called Zerona.
Yes.
And it sounds too good to be true instead of lipo.
Well, here's the way it works. Zerona doesn't target a specific spot. It targets your body. It causes the fat cells to empty, but the fat cell is still there, and that cell can still store fat if you don't change your lifestyle. You don't exercise, you don't change your lifestyle, that'll happen. So it's a commitment. Whereas if you do lipo, it takes those fat cells away from that problem spot. It works on a spot. You can do many spots if you want, and the problem's solved. So basically, people have to decide if they want to treat a spot or they want to treat their whole body, and how they want to go about this. All right?
Thank you, Wendy, for your call. 800-859-0WJR, 800-859-0957. Ken's calling from Algonac. Ken, what's your question tonight for Dr. Michael Gray?
Well, thank you, doctor, for taking my call. First off, my question would be, is there ever a time when an elective surgery could be paid for by insurance? I quit smoking several years ago, and I gained quite a bit of weight at one time, and I popped my belly button, which I believe is called a rupture. Is something like that covered by insurance by chance?
Yeah, that's not elective. Basically, the belly button is a weakness in the abdominal wall where the mom's blood vessels went into your umbilical cord, and it's weak. And as you gained weight, it spread to provide room inside, and the little hole opened up. It didn't rupture. It was always there. It just got larger, and you have a hernia. It's called an umbilical or belly button hernia, and that's covered by your insurance.
Ken, I hope that answers your question. Thank you for your call.